Good afternoon, everybody. As the Premier said, we have no new cases to report today. So as of today, we have 1,064 confirmed cases of COVID-19, 3 of them which are active. We've had a total of 54,317 individuals tested for COVID-19 with negative results, and we have 63 Nova Scotians who unfortunately have died from COVID-19. As many of you are probably aware, we've had 3 new cases of COVID-19 identified this week. I know that each case does bring concern, and particularly after having gone 20 days without any cases. As we've been doing all along, in each of the cases this week, we released the information that we can, respecting the need for privacy and the legal requirement around that. Like always, my public health colleagues at the Nova Scotia Health Authority conducted immediate contact tracing in each of the positive cases, and we have tested all their close contacts. Like we did this week, as you may have seen, if we need to do a public notification, because we're not sure we can contact all contacts directly, we have done that, and there was a notification around the first case about who was just the beginning of his infectious period when he flew from Toronto into Halifax, and when there was a public notification on that. We know that in all 3 cases, the people were recently outside of Canada, and we are comfortable concluding that that is where they would have come in contact with COVID-19. So the source of their infection was outside of Canada. We know in each case that the people did what they were supposed to do under the Health Protection Act in terms of any requirements for isolation. So that's comforting to know that people are understanding, and the protocols we have in place around temporary farm workers are working. Again, in each of the cases, when people became symptomatic, they came forward and got tested, and because they'd had appropriate isolation, we have had very few contacts, a half a dozen contacts in total from all 3 cases. So overall, this is very good news, which what we really expected, that the likely source of new cases in Nova Scotia would be from people exposed outside, especially outside of Canada, and that the things we have in place to rapidly detect people and the requirements around isolation minimize contacts here within the province. But it's an important reminder about the rules are there for a purpose. The rules around 14-day isolation periods and what we ask people to do to come forward and get tested as soon as they become sick. There's a reason behind those, and it's important that those are followed. As we said, we've tested contacts, that we may get some further cases from the small number of contacts that we have tested. That will tell over the next week to 2 weeks. But if people hadn't been isolating as they're expected, we could have had a much more serious situation. I can't emphasize enough the importance of the rules and the recommendations from public health are there for a purpose, and it's important that we all follow them. And which leads me to some observations I've made, that in the last week, since I was on self-isolation for 2 weeks, since that's ended, I've been able to be out and about a bit more. I've even gone into a couple of stores. But what I'm seeing, and certainly what I'm hearing from other people, is that I'm extremely worried that people are becoming complacent. That I'm seeing a lot of situations where people are not maintaining the 6 feet or 2 meter physical distance where that's possible. Lots of circumstances where our recommendation around masks is if you're in an environment around other people and physical distancing can't be maintained, so that's basically any indoor retail environment, malls, etc. The vast majority of people are not wearing masks. These are critical pieces, that keeping apart the physical distance as much as possible, and where that's not possible, wearing a mask. They're extremely important in terms of all of us practicing those. It's those measures along with the other personal preventive measures that I talked about last week. So staying home if if you're not feeling well, making sure you have good frequent washing of your hands, what we call cough hygiene. If you're coughing or sneezing into your sleeve. Being cautious about where your hands go and not touching your face, frequent cleaning of surfaces. It's all those things that we need to do together, along with the distancing and the masking, and then creating, whether it's retail environments, workplace environments, or community environments that support all those. Those are the tools we have to minimize the impact of COVID-19. We will get more cases. How we control the spread and what will allow us to remain open as much as possible is all Nova Scotians practicing that package of personal preventive measures. We have certainly strengthened our recommendation around masking, but we have a lot of work to do to change the norm around masking. So I'm really asking Nova Scotians to think about what they need to do to improve their practices around physical distancing. We're allowing some social contact, but being very thoughtful about how you limit that, and using masks where you can't physically distance, and all the other measures that I just described. We got to where we're at because we were very diligent about, and we had very tight restrictions. As we necessarily loosen those restrictions, we have increased risk. What will allow us to remain open as much as possible is all of us taking the preventive steps seriously. So we can't afford to have complacency about that, because we know that COVID-19 is not over. It is part of our new normal, and so we all have to be better at doing what we can to prevent its spread, to protect each other. I know that I've heard a lot, as the Premier said, a lot of concerns about people coming in now to Nova Scotia from outside Atlantic Canada. And as the Premier said, we are actively working to increase the collection of information and monitoring individuals as they come into our province, and making sure they're adhering to the isolation period. Lots of people are saying, well, we should not let people come. But that's really not practical or feasible. Opening up our province to visitors and Nova Scotians coming back is essential to many businesses, to our overall economy. It's also important for vital reasons for family and social connections. So we cannot remain locked down forever. We do have to open up and allow more travel, but at the same time we need to do that safely. And that's why we need to maintain the ability to test and have rapid public health follow-up, but it's equally important, as I described, all the personal preventive measures that we all need to do, that we need to really step up our game and be very thoughtful and careful about those, because it's those together. If we all do those, that allows us to remain open and allow us to have an open summer and enjoy a number of things. But if we're not careful, we run the very real risk of having a resurgence of COVID-19 and having to tighten things up again, which I know nobody wants to have. So I'd really ask people to maybe think about not worrying so much about each other, what others are doing, and focusing on what we're doing. What are each of us as individuals doing to prevent the spread of COVID-19? And just on testing, we know that the QE2 lab still remains 24/7 capacity, that there were 372 tests done yesterday. We're still making sure that Nova Scotians who are require testing have easy and rapid access to testing. I continue to remind people that if they have any of the symptoms that are on our COVID-19 website, any of the symptoms that could be associated with COVID-19, to reach out, do the online 811 assessment, and if you can't do that, to call 811, and you take their advice from there moving forward around whether you need testing or not. Today is the day where the new gathering limits, which we announced last week, come into effect. So I'm just going to remind people of what those gathering limits are. And it's an important reminder that as we open up all these opportunities for larger numbers of people to get together, these are places, these larger gatherings, where it's really important that the people around the rules, especially, if you can be social distance, you need to continue to be distanced. If you can't be sure of that, then it's really important that everybody wears a mask as part of allowing these gatherings to happen in a safe manner. So starting today, recognized businesses or organizations can hold outdoor events with up to 250 people. And indoor events can happen with 50% of the capacity of that indoor facility, up to a maximum of 200 people. The type of events that can be hosted are arts and culture events, special events and festivals, faith-based gatherings, and weddings and funerals. It's important to understand that these expanded gathering limits are only for events, these type of events, when they're run by a recognized business or organization. So, an examples of what that would, what could be a recognized business or organization are, if they're wedding or event planners, hotels and convention spaces, churches, synagogues, mosques, and various types of theaters. We have put this in place because we need to have a recognized business or organization who can take on the responsibility that on hosting an event that can follow the public health measures that will allow a gathering to happen safely. If you're thinking about having the gathering and it's not run by what we call a recognized business or organization, then that gathering limit must remain at 50. So, for example, if you're holding a family family reunion and somebody's or a backyard wedding, then the limit for that is it needs to be held at 50. That simply because if without a recognized business or organization that can be held accountable and has the resources to implement the proper safety measures, we need to restrict the number of people that can gather. Large gatherings of people are significantly increased risk for COVID-19, so it's important that they can be done in a safe manner. And in all of those scenarios, any type of gathering, whether it's up to 50 or the new limits, that its physical distancing must be maintained, except if people are from the same household or if they're in a pre-selected group, close social group of up to 10. Today is also a big day in terms of the Atlantic bubble came into effect this morning, and I know that our borders are very busy, along with the borders into our neighboring provinces as well. That it really allows us to open up, and now we're all Atlantic Canada. We are kind of all in this big bubble together. I know that a lot of businesses, especially related to tourism and public service, have very much been looking forward to today, and we'd like to welcome anybody from any of our Atlantic neighbors who are now making the trip into Nova Scotia. We ask that they familiarize themselves with Nova Scotia rules under the Public Health Act in a state of emergency, and follow those. It's important that they follow the rules while they're here, like all Nova Scotians. As we announced yesterday, any Atlantic Canadian resident who plans to visit Nova Scotia will be required to show proof of a permanent residency in their Atlantic province to be able to enter. There's a range of types of identification that are acceptable. Those are all on our website. We encourage Nova Scotians who are traveling to other Atlantic provinces to go to those provinces' website and familiarize themselves with the rules of the province that they're entering and the requirements for entry into those provinces. We've tried to make the identification that's necessary as consistent as possible to make it as easy as possible to move between provinces. But each province does have some different rules and some differences in the process for entry. And to make it easy, on our provincial website, so that's novascotia.ca/coronavirus, we've added links to the same type of websites in each of the other Atlantic provinces as well. So it's important to go online, whether you're going to travel, you're thinking of leaving Nova Scotia and then coming back for some type of vacation or trip. It's important that you familiarize yourself about what will be required when you come back to Nova Scotia and what will be required when you go to another Atlantic province. that it's important to understand that while we've made this change and created an Atlantic bubble, as the Premier said earlier, and I said too, there are no changes to travel from outside Atlantic Canada. We still have the requirements that anybody coming in from another Canadian province west of Quebec and west, or from any other country across our international borders, is required to isolate for 14 days, and that includes Nova Scotians. If you choose to take a vacation in Ontario this summer, you will be required, at this point in time, you would be required to come back and isolate for 14 days when you come back into Nova Scotia. Those are important because we still have varying epidemiology in different provinces in the country, and certainly anybody who's looked at all at the news, our neighbor to the south is in a very different situation related to COVID-19, and there's lots of COVID-19 activity in other countries as well. So it's important that we continue to respect the need to protect Nova Scotia by having strong isolation of people coming into our province where appropriate. I want to move on very quickly to a slightly different topic, but it is an impact of COVID-19. Earlier today, the Nova Scotia Health Authority announced that they will be restarting the grade 7 immunization clinics. So typically we have all our grade 7 students in our public schools are offered a range of vaccines on different occasions throughout the grade 7 school year. Those clinics weren't able to be the third dose of vaccines weren't able to be offered this spring. So public health, in anticipation of needing to do the new grade 7 class in the fall, and maybe having to do something somewhat different for them, we need to make sure that the students who have just graduated from grade 7 get their vaccinations throughout the summer. So public health will be holding clinics in July and August for the recently graduated grade 7 students. There'll be a lot more information coming to those families and to those students. We're working with community partners. We're working with our partners in the regional centers for education on this. The clinics will be held and run in a way that keeps social distancing, so they are designed with COVID-19 safety as top of mind. More information on that will be coming out, but I wanted to make sure people were aware of that coming. And if you've had as a family, if you've had a student recently graduated from grade 7, pay attention. There's more information coming, and I highly recommend, or more than highly, I can't say how important it is that any students who didn't get that third dose of vaccine against the diseases we immunize against are all important. Hepatitis B, human papillomavirus, HPV, meningococcal disease, tetanus, diphtheria, pertussis. Those are all very important to continue to be protected. So this is a critically important thing to put into your schedule as you get more information. Make sure that the students finish off the vaccine series. In conclusion, I know that as we went through the last 20 days with no cases, that people were feeling a sense of relief. And perhaps that's contributed to a feeling that things are over and we can let our guard down, but that couldn't be further from the truth. We have to continue to pay attention to COVID, continue to be wary about it, and take the necessary prevention steps. And maybe the cases of this week are actually, in some ways, a fortunate reminder about our needing to maintain our vigilance, that COVID-19 is part of our new normal, and that as we continue to open things up, necessarily so, we do have risk of COVID-19. And as I said, that the way we control this, it's in our hands to a large extent. We need to all take ownership of the things that we can do, the steps I've outlined last week and outlined again today, that what are each of us going to do to make sure that we're keeping each other safe by following all the preventive steps around COVID-19.